Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator here at the Craig H. Nelson Rehabilitation Hospital. Thank you for taking the time to watch this video about managing your Areflexic bowel program. Please pause the video and take a moment to read this important disclaimer. Thank you. Here are the objectives that we'll talk about in this video. We want you to understand the steps of your bowel care program and know when you should discuss bowel issues or bowel concerns with your medical team. So areflexic neurogenic bowel means that you have a spinal cord injury that impacts the lower motor neurons of your spinal cord. So typically, people that have injuries at the level of T12 or below have areflexic neurogenic bowel. This means that there's decreased voluntary control of the anal sphincter and that the anal sphincter tends to rest in a looser position, which is why it's so important to make sure that bowel care is done regularly and completely so that accidents don't occur. So bowel will collect in the rectum until it's manually removed. People will do areflexic bowel management 1 to 3 times per day, so this is more or less often to meet your needs. Some people find it helpful to do their bowel care shortly after having a meal. Here are the supplies that are needed for areflexic bowel management, so gloves, a water-based lubricant, wet wipes, baby wipes, or simply toilet paper. And it's important to know that unfortunately insurance companies typically don't pay for these supplies, so it's important to purchase these supplies before you go home. For positioning, being upright is going to be optimal. So anytime that you have numbness or decreased sensation on the sitting area, it's important to be on either a padded toilet seat or a padded commode chair. So talk with your occupational therapist to see what specific piece of equipment they would recommend for your bowel care. Areflexic bowel management typically doesn't take this long, but if for any reason your bowel care is taking longer than 20 minutes, it's important to make sure that there's a safe way for you to be able to do a pressure release from the equipment that you're doing your bowel care on. If there's ever a day where you're not feeling well or you need to do your bowel care in bed for any reason, it's helpful if you can be lying on your left side and have someone help you bend your right hip and your right knee, because that will allow you to have a more complete emptying with your bowel care. To manually remove the stool, you complete a process that's called manual disimpaction. So you make a hook with your finger and hook your finger around the stool and simply remove it. So of course you want to do this with a gloved and lubricated finger, and you repeat this process every 5 minutes. And it's helpful if your stools are firmer so that it's easier to hook and retrieve it out. And here are some other techniques that can help promote stool movement. So you can do an abdominal massage, which is a massage in your abdomen in a clockwise motion. Change positions, but of course make sure that you have your balance, but you can simply lean forward or side to side. Breathe in and out deeply or bear down without holding your breath. So you know that your bowel care is complete when there isn't any more stool present. The average person takes 10 minutes and 2 removals in order to reach completion. So if you do run into any issues with diarrhea or constipation, here are some problem-solving strategies. So if you're having a lot of spicy foods, a lot of caffeine, if you're on antibiotics, or if you're using a bit too much of laxatives or stool softeners, if you have an infection like a respiratory infection, the flu, or if you're feeling more stressed out than usual, this could result in diarrhea. And so work with your medical team to see if there's any adjustments you can make to your laxatives or stool softeners that might help this problem. Eating yogurt can also be helpful, and your provider may want to consider if you have a blockage, because it could be diarrhea that's leaking around the blockage. If you're experiencing constipation, it could be caused by inconsistency, not doing bowel care frequently enough, or not completely emptying during your bowel care. It might also be that you're not getting enough fiber in your diet. It could be related to lower physical activity or not drinking enough water. So the first solution would be to make sure that you're doing your bowel care regularly, or see if you need to increase the frequency. You may need to increase the amount of fiber that you're having. And anytime that you're increasing fiber in your diet, you also want to make sure that you're drinking additional water. and reasons to call your doctor regarding bowel care when you're at home. If you find that you're having accidents outside of your regular bowel care time, your doctor will want to know about it. If you have diarrhea that lasts for more than a day, and if you're not having consistent stool results. So the medical team gets particularly worried if you've gone 3 days without having a bowel movement. So if you've gone 2 days, you want to put a call into your provider to get an appointment to be seen the next day on the 3rd day. If you have black tarry stool, your medical team will want to know because that possibly could indicate that you have a blockage. If there's any blood in your stool, you'll want to call your doctor, and if you're feeling shortness of breath while you're having a bowel movement. And as always, please contact your primary care team with any questions or concerns.